let's talk today about sutures. So one of the common questions patients have is, doctor, are the sutures absorbable, or do I have to come back and get them removed? Well, there are actually two types of sutures, and I'm gonna try to give you a simplified version of all the things that we look at in sutures to decide which ones we're gonna use. So there are absorbable sutures that are usually used internally, and there are sutures that are non-absorbable, that basically are not going to go away. Those are usually used on the skin, and they do have to be removed. That's in general terms. For the absorbable sutures, one of the most common types that we use is a monochrome suture. And then you will hear frequently the surgeon saying, well, let me have a 3-0, let me have a 4-0, and what does that mean? So basically when you look at the sutures here, and you can see that number, it talks about the size and the strength of the suture. A 3-0 suture, it's going to be a bigger and more strength than a 4-0 suture. So also, for example, if you have a 2-0 suture, it's actually an even stronger, even a little bit thicker suture. Then the other thing that is very important is to see the type of the needle. And there are multiple, a whole bunch of different types. But in general, there are needles that are non-cutting, such as this one. They're called taper, and they are needles that are cutting. So the non-cutting needles are usually used in tissues that are going to be easily, where the suture can kind of rip through the tissues. And the cutting needles, which usually plastic surgeons use a reverse cutting, is used for the skin. And basically, when we decide what type of sutures we're going to use, we have to understand the area that we're working at, the reason why we need suture. We need them to stay there for a longer period of time, or just for a short period of time. We also consider if we want to leave if you want to avoid leaving a scar, then you use certain type of sutures and suturing technique as well. And that's it's a process to decide which sutures we're going to use for each case. Now, most of the cases that we do, the surgeons have what is called a preference card, so we don't have to make those decisions every time we're operating. So in that particular preference card, for example, for a eyelid surgery procedure, I have my specific sutures that I use for that, and that I have selected years ago, and so that all the time the sutures that I use for that procedure are the same. I don't have to make these decisions at that time. But when I sit down, I'm going to do a procedure and I decide which sutures I'm going to need, then those are the things that I look at. Does it have to be absorbable, not absorbable? How much strength, how bigger the actual suture has to be, what type of needle is it, cutting, non-cutting, what's the size of the needle, if it's a small one or if it's a bigger one, and so and so. So there's a lot that goes on even to decide just about simple sutures.